Welcome to our comprehensive guide on pink eye, also known as conjunctivitis. This common eye condition affects millions of people every year, causing discomfort, redness, and irritation. In fact, pink eye is responsible for an estimated 3 million missed school days annually in the United States alone. Whether you're a parent, teacher, or simply someone looking to understand this prevalent eye issue better, this video will provide you with all the essential information you need. Let's start by understanding what pink eye actually is. Conjunctivitis is an inflammation of the conjunctiva, the thin, clear tissue that covers the white part of your eye and the inner surface of your eyelid. When this tissue becomes inflamed, it causes the characteristic redness that gives pink eye its name. But why does this happen, and what does it mean for your eye health? To truly grasp the nature of pink eye, we need to take a quick look at the anatomy of your eye. The conjunctiva plays a crucial role in protecting your eye and keeping it moist. When it becomes irritated or infected, you'll notice a range of symptoms beyond just the telltale redness. These can include swelling of the eyelids, increased tearing, a gritty feeling in the eye, and discharge that may form a crust overnight, making it difficult to open your eyes in the morning. While these symptoms can be uncomfortable and unsightly, in most cases, pink eye isn't a serious condition. However, there are times when you should be concerned and seek medical attention promptly. If you experience changes in your vision, severe eye pain, or extreme sensitivity to light, these could be signs of a more serious eye problem that requires immediate evaluation by a healthcare professional. Now, let's dive into the different types of pink eye and their causes. Understanding the specific type you're dealing with is crucial for proper treatment and management. The three main categories are viral, bacterial, and allergic conjunctivitis, with a fourth type caused by irritants. Viral conjunctivitis is the most common form, often accompanying a cold or respiratory infection. It's highly contagious and can spread easily through direct contact or by touching contaminated surfaces and then touching your eyes. Symptoms typically start in one eye and may spread to the other. Along with the eye symptoms, you might experience cold-like symptoms such as a sore throat or runny nose. Bacterial conjunctivitis, while less common than viral, is also very contagious. It's characterized by a thick yellow-green discharge that can cause your eyelids to stick together, especially after sleeping. This type of pink eye can be more severe and may require antibiotic treatment to clear up. Allergic conjunctivitis is not contagious, but can be just as uncomfortable. It's triggered by the same allergens that cause hay fever, such as pollen, pet dander, or dust mites. If you have seasonal allergies, you might find your eyes becoming red, itchy, and watery at certain times of the year. This type of pink eye often affects both eyes simultaneously. Lastly, irritant conjunctivitis occurs when your eyes come into contact with substances that irritate the conjunctiva. This could be chemicals, smoke, or even a foreign object in your eye. Contact lens wearers are particularly susceptible to this type of pink eye if they don't follow proper hygiene practices or wear their lenses for too long. Understanding the type of pink eye you have is crucial because it determines the most effective treatment approach. Let's explore the treatment options for each type. For viral conjunctivitis, the good news is that it's usually self-limiting, meaning it will clear up on its own within a week or two. Treatment focuses on managing symptoms and preventing spread. Applying cool compresses to your eyes can help relieve discomfort and reduce swelling. Artificial tears can also help soothe irritation and flush out any discharge. Bacterial conjunctivitis, on the other hand, typically requires antibiotic eye drops or ointment prescribed by a doctor. It's important to complete the full course of antibiotics, even if your symptoms improve, to ensure the infection is fully cleared. You should see improvement within a few days of starting treatment. For allergic conjunctivitis, the key is managing your allergies. Over-the-counter antihistamine eye drops can provide relief from itching and redness. In some cases, your doctor might recommend prescription eye drops or oral antihistamines for more severe symptoms. Avoiding your allergy triggers when possible is also crucial for prevention. When it comes to irritant conjunctivitis, the first step is to remove the irritant and flush your eyes with clean water. If a chemical splash caused the irritation, it's important to seek immediate medical attention, as some substances can cause serious damage if not treated promptly. Regardless of the type of pink eye, there are some home remedies that can help alleviate symptoms. Applying a cool compress to your closed eyes several times a day can provide relief from discomfort and help reduce swelling. Proper eye hygiene is also crucial. Gently clean your eyelids with a warm, damp washcloth to remove any discharge, being careful not to touch or rub your eyes directly. While treatment is important, prevention is even better when it comes to pink eye. Let's look at some strategies to reduce your risk of getting or spreading conjunctivitis. Good hygiene practices are your first line of defense. Wash your hands frequently with soap and water, especially before touching your face or eyes. Avoid rubbing or touching your eyes, as this can introduce bacteria or viruses. If you need to touch your eyes, make sure your hands are clean. To prevent the spread of pink eye, avoid sharing personal items that come into contact with your eyes. This includes towels, washcloths, pillowcases, and eye makeup. If you or someone in your household has pink eye, wash these items frequently in hot water to kill any lingering bacteria or viruses. For contact lens wearers, proper lens care is crucial in preventing eye infections. Always wash your hands before handling your lenses. Clean them according to the manufacturer's instructions, and replace them as recommended. If you develop pink eye, switch to glasses until the infection clears to avoid recontamination. In school and workplace settings, it's important to follow guidelines to prevent the spread of pink eye. If you or your child has contagious conjunctivitis, staying home until the symptoms improve is often recommended. This typically means waiting until there's no more discharge from the eyes and they're no longer red or irritated. As we wrap up this comprehensive guide to pink eye, let's review some key takeaways. While pink eye is common and usually not serious, there are times when you should seek medical attention. If your symptoms don't improve after a few days, if you experience severe pain or vision changes, or if you have a weakened immune system, it's important to see a healthcare provider. While complications from pink eye are rare, they can be serious if they occur. These might include corneal inflammation or spread of the infection to other parts of the eye or face. This is why proper treatment and follow-up are important, especially for severe or persistent cases. Finally, remember that recovery from pink eye is usually straightforward. Most cases of viral and bacterial conjunctivitis clear up within 1–2 weeks, even without treatment. Allergic conjunctivitis may persist or recur seasonally, but can be managed effectively with proper care and medication. By understanding the causes, symptoms, and treatment options for pink eye, you're well equipped to handle this common eye condition. Remember, good hygiene and prompt attention to symptoms are key to managing pink eye effectively and preventing its spread. If you have any concerns about your eye health, don't hesitate to consult with a healthcare professional. Here's to clear, healthy eyes and a better understanding of this prevalent condition.